Bisecting the angle technique is just another method that can be used to expose periapical films. And you might hear it called bisecting angle technique, just the bisecting technique. Also, some people call it the short cone technique, but all of those words, all of those titles are used to describe this technique that uses geometry as a basis for the angle that you will set your central ray at. So, as I mentioned, the bisecting technique is just an alternative to the paralleling technique when you're taking PAs. And it's good to use when it's difficult to use the paralleling technique. And these situations may be when the patient has abnormal anatomy. The patient isn't maybe cooperating, they won't close their mouth fully around the film holding device with the paralleling technique. And it's going to use a size 2 film. Size 2 is going to be used in both the anterior and the posterior when taking x-rays using the bisecting technique. A device called the snap array is used, and that is what is pictured below. And it's recommended to start in the anterior area, and you're going to use a vertical film placement, and then move to the posterior with horizontal film placement. The basic principles for the bisecting the angle technique are as follows. First, the film is placed along the lingual surface of the tooth. The end that is closest to the apex must rest against the palate, and the end that's closest to the occlusal surface should extend about 1/8 of an inch beyond that occlusal surface or incisal surface. Where the film and the tooth come into contact forms an angle. The next step is to visualize a line that divides that angle. So you want to picture a line that cuts that one big triangle in half into two equal triangles. This is your imaginary bisector. The next step is to direct the central ray perpendicular to the imaginary bisector. So you are sending this central ray at a 90-degree angle, or to create a 90-degree angle between the imaginary bisector and the central ray. When you have done that, you have bisected the angle. So let's take a little bit closer look at that with some visuals here. So the X-ray beam is directly perpendicular to the imaginary line that bisects the tooth. So here we have the receptor. So this pink line is the receptor. And that receptor is whether it's the sensor from a digital film or it is your traditional film. And right here, where I am putting this blue X, is where the film or the receptor and the tooth come into contact with each other. This is creating your first angle. So that first triangle that we see will be right here. What's one side of it? And then the other side of it follows along there. The next step was to visualize the imaginary bisector. So this line right here, that is that imaginary bisector. And you can see it is cutting this one big triangle in half to form two equal triangles. So here I would have one side of one triangle, and there's the other side of the other, and then they share a side. So we have the other side of the triangle would be right here. Now keep in mind that all of these things are going to be equal and a little bit more accurate than my hand drawings here, but those are your two triangles. So next we have the central ray, which is sent traveling towards the receptor, at that 90-degree angle or perpendicular so that it creates that 90-degree angle. And here you can see where it were to hit would be that 90-degree angle. So when this rule is followed, what turns out on your receptor should be an accurate representation of that tooth. So what are some reasons that we would choose this technique over the paralleling technique? One is going to be that it's more comfortable for the patient. You don't have the big bulky XCP or the film holding device in the patient's mouth. The snap array is pretty low key when it comes to inserting it to the patient's mouth because it lays flat, they bite on it, and it's just more comfortable in general. Also, the film is going to be placed at an angle to the long axis of the tooth, so it just sits more comfortably in the mouth altogether. Therefore, it's a little bit less likely to pinch the tissues. A film holder is not needed, and there are no anatomical restrictions. Because we are able to change that angle of the beam to make sure that it is always perpendicular, we don't have to worry as much about the anatomical restrictions or the abnormalities we may come across. With that paralleling technique, we're stuck. Wherever that film holder and paralleling ring go, that's where that beam has to go as well. Where with that bisecting technique, you're a little more free to move things around as needed. And that includes not just the beam, not just the central beam, but it also includes that film. That film can be moved around to different angles to accommodate all of your different situations. Here's a couple different situations that you might consider using the bisecting technique versus the paralleling. First is if your patient has a shallow palate. Again, you can just change that angle of the film. If they have large palatal torus, a shallow or tender floor of the mouth, you don't have that XCP pressing on those tissues. Or a short lingual frenum where the patient may be tongue-tied. Their tongue doesn't move around as easily. You might not have as much room to work with to fit that film holding device in the patient's mouth. So the bisecting technique may be your technique of choice for this. And like anything, we have our advantages, but we also have our disadvantages. There is more distortion created when using the bisecting technique. The film and the teeth are at an angle instead of parallel. And when we do that, it can create that distortion, such as the image on the left. So you can see that this image right here has slightly shorter roots than what it maybe should. So that is going to be one of the distortion measures. It's harder to position the X-ray beam with the bisecting technique. Sometimes it's difficult to visualize where that film is. Once that patient has shut their mouth, you don't know where you're aiming that beam sometimes. As you go, as you practice, as you become better at this technique, you'll have no problem or your problems will be minimized. But when you're first starting out, you have nothing to aim at. You have to pay attention when you are placing that film and visualize and look where on their face is that film in alignment with. And the film is less stable. With the paralleling technique, not only do you have that ring that you are able to aim the beam through, but your film is held in place with the bite block. With the bisecting technique, you don't have that. So that creates more chance of moving. And also with the bisecting the angle technique, the angulation of the PID is important. That paralleling technique, again, you aim it at that beam, you aim it at that ring, and you're going to be basically spot on. With the bisecting technique, we have to pay more attention to how that PID is angled. So the alignment of the central ray in the horizontal or vertical position is what we're referring to here. The horizontal positioning, that's your side to side. So shake your head, no. That's your horizontal positioning. Incorrect horizontal angulation can create overlap. This can happen with the paralleling technique as well, but because you have that ring to aim at, it's reduced. Then your vertical angulation, this is your up and down. So think about nodding your head yes, shaking your head yes. Incorrect vertical angulation will create one of two problems. We have foreshortened images, and this is where the teeth appear too short. This is caused by too much or excessive vertical angulation. It's too steep. And the other type is an elongated image where the teeth appear long, and this is from insufficient or not enough vertical angulation. Your PID has been too flat. And this is an example of foreshortening or foreshortened images. The teeth look short and stubby. Or we have some elongation. Those teeth kind of look like they've been stretched out or spread out. They are elongated. And to review, this is kind of a short unit, so we've got a shorter review, but which describes the proper direction of the central ray in the bisecting technique. A, 90 degrees to the long axis of the tooth. B, 90 degrees to the film and the long axis of the tooth. C, 90 degrees to the film, or D, 90 degrees to the imaginary bisector. The correct answer is D, 90 degrees to the imaginary bisector. And incorrect vertical angulation could cause A, overlap. Incorrect vertical angulation could cause A, overlap, B, foreshortening and overlap, C, foreshortening and elongation, or D, elongation only. And the correct answer is C, foreshortening and elongation.